Had successful that.
Y tuvo muchísimo éxito.
And also continually for this year.
Y también continuamos este
and
año.
I am very happy the collaboration. Really, it is something very important.
Y estoy muy contento que hay mucha colaboración porque es algo muy importante.
It is not important only because I am Tibetan. We are some Tibetans in the Tibetan culture.
Y no es solo importante porque yo soy tibetano y tenemos los tibetanos una cultura.
Because the Tibetan culture, it has such kind of quality for international level.
Porque la cultura tibetana tiene mucha calidad a nivel internacional.
We must understand that and diffuse that knowledge. All human beings, they used it is useful.
Y tenemos que entender que el desarrollo y la difusión de este conocimiento es muy útil para todos los seres humanos.
And also I want to say thank you very much. Our guests, very far distance, they arrived safely here.
Y también quiero dar las gracias a todos nuestros invitados que han venido desde muy lejos de manera
And really I am very happy
segura.
for that. Also we have something concrete here.
Y estoy muy contento que se ha creado algo muy concreto aquí.
And we are concentrated in this year mainly in Tibetan medicine.
Y este año está concentrado fundamentalmente en la medicina
That is
tibetana.
not only Tibetan culture. Tibetan culture we have many aspects.
Y no es solo la cultura tibetana. En la cultura tibetana tenemos muchos aspectos.
But medicine is something very useful for everybody and everywhere.
Pero la medicina es algo muy útil para todo el mundo en todas partes.
And particularly here we have guests, not only Tibetan doctors, but very, very special guests, very honorable, really.
Y aquí tenemos invitados que no solo simplemente son los médicos, sino gente muy respetable y honorable.
So this occasion, then people also can learn a little, make understand how is then Tibetan medicine in the culture.
Y gracias a ellos la gente puede entender cómo es la cultura tibetana y la medicina
For that
tibetana.
reason, I am very happy in this occasion. There is also collaboration of the local authority, and we are organized, many people there are also interested.
Entonces estoy realmente muy contento de que se ha organizado esto y tenemos la colaboración de las autoridades locales y de la gente locales y de mucha gente que ha
And we do
participado.
our best.
Y vamos a hacer lo
Thank you
mejor
very
que
much
podemos.
for everybody your participation.
Y os agradecemos a todo el mundo vuestra participación.
Good, eh? Fantastic.
Es un regalo, díselo.
So Arura is formed. Arura is an association about the Tibetan medicine in the northeast Tibet region. So they formed with 5 groups, sort of 5 like included a hospital, university, and a museum, so on and so forth.
That's Arura the conditional Mongozio, Namande Tande Ak Conchok Gyaltsen. Tene Lusham tene Roma
So this time we came 4 people attending this conference. One of the members is this Professor and the Dr. Kunchok Gyaltsen, and then the second one is the Dean of the Tibetan Medical University, and also Professor and the Doctor, author of the many books that the Dr. Lusham, and also Ms. Thomas, she's a biochemistry professor in the Namkhai.
Tate Namkhai uchu sawu mochayla. Taranta so nga chi chizu instungande nga chi ta lo mambu nang lo nushi chatsu nang so ma chi leka chma chambuzi le no tawa ge tarang de wochi suru tande tenjo sonne te ta thang indana ta rumbu che chi chimbu kyong le de shi le ta nga chu de suzi de chi jin santa sawu Namkhai tarang ga.
So all the Arura we will explain, as we said, is next few, like next days, like tomorrow. Today is one of the main purpose trip to here is the last 20 years. What we're doing, one of our major project is to work on this book, which we call is collections of the Tibetan medicine. So this collection of the Tibetan medicines, we like to present to Rinpoche. All Tibet scholars, professors, doctors are participated work in this. As I said, like over 2,000 people is involved in this book. And then there is over 6,000 chapters of a book. And the total is 61 volumes.
Muchas gracias.
For example, just like in Buddhist tradition.
Por ejemplo, en la tradición budista.
You see, Buddhist is developed in India.
Veis que el budismo se ha desarrollado en India.
Buddhism, Sutra, Tantra, etc. developed in India and in Odisha.
Las enseñanzas budistas del Sutra y Tantra se desarrollaron en India y en Odiana.
In ancient times, already Tibetans, they are very much interested in spiritual path.
Y antiguamente los tibetanos estaban muy interesados en el camino espiritual.
Because it is not so easy very much for developing and communications at a more physical level.
Porque no era muy fácil comunicarse a nivel físico.
So for most of them, they are also dedicated to more spiritual path.
Y por eso se dedicaron más al camino espiritual.
Of course, the spiritual path very developed, just like in India and Odisha.
Y evidentemente el camino espiritual ha sido muy desarrollado como en India o en
scholars, etc. They are sacrificed going in Odisha, going in India, etc. Translating, inviting important teachers, etc. And developed that spiritual path in Tibet.
Last night, Rinpoche was speaking, Tibetan culture and Tibetan history traced back to over 4,000 years. Particularly for Tibetan medicine has a long history, over 4,000 years traced back to Xiangxiong.
Entonces, como explicó también ayer Rinpoche, sobre la cultura y la historia tibetana, que es muy extensa y muy antigua, de más de 4.000 años, especialmente la historia de la medicina tibetana, que se remonta a los orígenes de Xiangxiong.
Among the traditional medicine, Tibetan medicine has the most collection of classical books as documented.
Y la medicina medicina tibetana tiene la colección más extensa de libros de medicina antigua.
In order to carry on Tibetan medicine, we have to work very hard to preserve those pictures of the books. Still, there are a lot of books need to preserve in West Tibet.
Y entonces hay todavía un trabajo muy extenso que hacer, como podéis ver en las fotografías, para preservar todos estos libros, y todo esto se está haciendo en el Tíbet oeste.
We are able to publish over 100 books in Tibetan medicine, which are classical Tibetan medical texts.
Actualmente hemos podido publicar más de 100 libros de medicina tibetana tradicional.
One of the projects yesterday we mentioned here is this books, 60-volume book, which is called Tibetan Medicine, an extraordinary collection of classical texts.
Uno de los libros que hemos publicado ha sido esa enciclopedia de 60 volúmenes que trata de la medicina tibetana y de publicaciones extraordinarias de libros.
These textbooks are collected from the over 600 resources to combine into one book, which is the most high qualified books in Tibetan medicine.
Estos textos vienen de más de 600 fuentes diferentes y están recogidos en una, y es uno de los libros de mayor cualificación que existen.
The content of this book are history of Tibetan medicine, commentaries, etc., and including those 8 main components.
El contenido de estos libros son sobre la historia, comentarios y 8 componentes principales.
Today's my topic is how to take care of a pregnant woman. Yes, everybody understanding that is very important. Why? Because we all, once upon a time, we also pregnant in the mother's womb. And also future, our taking care of our generation also will come into the mother's womb. No one discussing how children come, so that is a unique way to come, which is the past, present, and the future ideally. So what I do today, presenting that the pregnancy time is divided into 3 categories. The first part is the how to conceive, and then when to conceive, and what's the materials of the conceive. And the second one is how the fetus is developed in the mother's womb. And the third is how we observe the signs or symptoms through birth, and then once we have the birth, how we need to take care of the baby. Good morning for everybody. So today our topic is discussing on the embryology and then how to develop baby. This is a very important topic. When we're looking at our personalities and our lifestyle or our character, each person have a different character. Where this beautiful character came from? What happened to have this kind of character? So this very important topic go back to the conceive. That is the root of where our beautiful character came from. Maybe sometimes your character don't like the other people. Sometimes also you don't like your character, you wishing I have a little different character. Character is something that goes with you rest of your life. Yes, you can train to make smooth, or you can train to changing something. Good morning for everybody. Today's my talk, the topic is for the pediatric, for the children. So when we're talking is the children's disease or children's care, in the Tibetan medicine we have 3 main chapters. And the first chapter is we are talking about we call is Chipanyawar Jeba.
Nyewarjeba means is sort of like the continue from the yesterday's topic. Soon after give the birth, the children, from that time till 1 year old, what we need to do. So the Chiba Nyewarjeba is basically in 1 year. And the second chapter is like the disease, treating the disease. And the third is treat the provocations. So the provocation chapters we have in general when we're talking, about pathology, we have 5 chapters of based on the provocation disease in generally. And then children's, when we're talking, we have specific 1 chapter for the provocation. Because is childhood time is the several reasons they're easy to attack by the provocation. Tibetan culture and the Tibetan medicine and the Tibetan culture is not only benefit for the Tibetan and in Tibet, but is something benefit to all the sentient beings, all the humanities. You may know about the Tibet and the Tibetan culture, and then maybe some of you are new. So when in the Tibetan medicine is same as like with a regular medicine, is when we're talking about the medicine, there is 2 aims. So the 2 aims are, one is try to prevent, the other one is try to treat. So how we try to prevent and how we try to treat, so that the Tibetan medicine, we say, is the 5-element theory.
As Dr. Phuntsog said, focused, there is the aspect of the breathing that is central to the practice of Yantra Yoga. Somehow, in Yantra Yoga, is designed around different aspects of the breathing. We should understand there is not only the quantity of the breathing, there is the quality of the breathing. There is not only the more material aspect of the function of the breathing, there is the aspect of the function of the breathing related to the condition of our energy.
Ani detang di jawa gini semne korgi terjindor di tindaji antanjila ni nyansonshiai.
Today's my topic is based on the Tibetan psychology, and also when you have like in the clinical how to treat and how to work, how to diagnostics, so this kind of.
Tanda na dan di zo sum tindaji chiti ani pome nari ani na chue nari ngarang chugi sem sayati la ani shiba sayati la kandes ninjin chege yobada ani titawi ju samti chongsa ge wangbo na ten na di karimba tichiche.
So there's 3 arguments or 3 topics I'm going to discuss. The first one is either the Tibetan medicine or the Tibetan Buddhism. What is the consciousness? What is the mind? What is the mental or what is the mind? And also, where is the mental is located? What's the support or what is the base of the mental? So this is the first argument.
Nibai ni sem titawi sem di ani junde nari junde mai bai nari netang ne yo me ni parula kandas judo chungi yo pada ani titawi sem ti lika khari che ki yo pati shuyayins.
Second topic is how to distinguish the healthy and the unhealthy mind, or the balanced and imbalanced mind, and what is the factors to make the imbalance, and at that moment what is the concepts.
Sumba di ani ta nechi la pisha che ani titawi ta chi semne solong soratinda choya ge ani ju khari re chen khari re ani tela ani ju ta ta ti manjawa khari tongyore ta na jingi ni te ji so thep kul khande imba doti mutations.
So the third one is to sort of like a clinical one, sort of like a metaphor of a disease, and then what is the cause of that disease, what is the conditions of that disease, what's the symptoms of the disease, and how to treat. So third argument is based on the clinical.
Tonight we would like to introduce Tibetan medicine external therapy. I will introduce in general external therapy introduction, and then Dr. Phuntsog will explain what is Kunyi therapy, and then Ado will show the practice and demonstration. In treatment, generally there are 4 therapies. The first one is diet, second is the behavior therapy, and then third is the medicinal herbs, and then the fourth or last one is the external therapy.
So when we applied the Kunyi, we have 2 different way of applying. One is on the ground, which is on the floor, and the one on the table. So now, like this technique is warming up, so sort of try to apply the oil on the skin, but then now is more deeper, like working on the muscles, the fat level, so try to create the heat. So this point is we consider is one of the major lung points.
Y este es considerado uno de los puntos principales del lung.
So this point is good for to lung calm down.
Y este punto es muy bueno para calmar el lung.
So this include a look at the patient's eye, inside of the eye, the color of the eye, the nerve, pictures of the nerve system in the eye, and also look at the tongue, look at the color of the tongue, and look at the facial like color, and also look at the urine, look at the blood, look at the spit, look at vomiting things, the objective of vomiting, and all those things can be seen by the physician. That's second is the Gen.
Segundo es el ten.
Chak.
Y chak.
So upper is looking at the major organs, and the lower part is looking at the hollow organs. So the under the Gen, and the upper is the liver, and the lower is gallbladder. And under the chak, upper is the left kidney, and lower part is the urinary bladder. Greetings to everyone. Today I would like to share diagnosis in Tibetan medicine. In Tibetan medicine, the diagnosis can be understood in 2 parts. The first part is the content of diagnosis, which is the principles and the theory of how to diagnose illnesses. The second part is the actual method, which is the questioning, looking, vigilant, and also touching. Thank you. Good evening. Tonight I would like to share food and drink in Tibetan medicine. Again, this is a big topic, so over 1 hour, it's a little bit impossible to cover everything. Therefore, I will briefly discuss about the principles of food and drink, and then how we can apply with the real food. So this talk also based on somebody who is not going to be a doctor. Otherwise, this will be more in-depth and more complex subject. As we know, we all have this physical body with vital organs and hollow organs. The diet mainly go through those hollow organs and finally go through the part of all the bodies. Why we every day drink and eat? Because our body is made from this 5 elements: earth, water, fire, and wind. And then also there's a space. Because of this condition, our body is formulated this. So then this is also part of the universe. So we every day take a part of the universe feel into our body in order to maintain the body for a certain time.
Good afternoon for everybody. Tonight's our topic is based on the Tibetan medicine, how to harvest the herbs and how preparing the herbs. In general, in the Tibetan medicine, in a sort of a medicinal, when we're talking the medicinal, there is 3 major components. One is the animal product. One is the seeds and the herb, seeds and the plant. And then the third one is the herbs. But the herb is the more common.
Tege nala dombi pam mandawa ni tong ni jwa guchul has ten yor de tinang ki jacha ki dunchi tong shi tinda chi ngomang ki senyore.
So in the Tibetan there are many Tibetan herbal books. The one of the very famous Tibetan herbal books called is The Necklace of the Crystal. So in that book they mentioned over 2095 plants and herbs in the Tibetan medicine. 75 of the medicinals are in the herbs.
So today the subject is the older people's care. When we say older people, it's very funny because everybody wants to be young. It's okay in Tibet we say you look older, people would be happy. I don't know in Europe, but in America, when you say you look older, that's very bad. So in Tibetan medicine, there's a care of older people, and the way present in the textbooks are mainly rejuvenate the physical body through spiritual practice. Even though we use rejuvenation pills and medicinal herbs to make a Gyaltsen. In Tibetan we call it Gyaltsen pills. But more important is the spiritual practice. Since we are talking about this, the senior care in the West, I tried to match with your cultural situation. In terms of the division of younger children, younger people and senior people in Tibetan medicine. For the senior in the Mangogyu, which is the third part of the Yushi or the Yushi, are two words saying Penjur Dinchi part the Dharma te Tilisepa Pench Gembuyins. The meaning is before 16 years old we consider children. Then after 16 years old until 70 years old, that's considered as a dharma. Dharma means adult. It's like a stronger body. And then, as you know, a long chipa packing has a 5-5. The other day we described. And then chipa dangyo. So in the skin make lighter. So those are reduced. So then the skin became less colorful or less look better.
Cuando decíamos con la categoría long tripa pegen es un 5-5, un tripa pegen quiere decir que quiere decir que la piel va perdiendo esa vigorosidad, ¿no? Va perdiendo luz.
And then also on the face, for example, like more wrinkles, and then the flesh, all those will be loose.
Entonces también aparecen arrugas en la cara, se descuelga la piel, la carne no es tan fuerte.
And then the thinking also slower.
Y también uno piensa más despacito.
So those are the typical symptoms as a universal. Everyone would have.
Y estos son síntomas universales que todo el mundo tiene.
Yeah. So you think those signs of the senior, you should think those are the senior signs. Look great.
Entonces, si miras a una persona mayor y ves que tiene los signos de la vejez, tienes que pensar, estos son los signos de la vejez, es maravilloso.
We have still many years, but nobody knows.
Todavía muchos pensamos, nos quedan tantos años, pero realmente nadie lo sabe.
We have no any guarantee.
No tenemos ninguna garantía.
Some people say, oh, I am very young, but the young and the old, there is not much difference.
Algunos dicen, pero soy muy joven, pero entre joven y mayor no hay tanta diferencia.
Our life is just like a candle, you light it in an open place.
Nuestra vida es como una vela en un lugar abierto.
There is so many then secondary causes, just like wind, for eliminating our life.
Hay tantas causas secundarias como por ejemplo el viento que pueden acabar con nuestra vida.
So important is not only we are looking in front of us what is, but we are knowing we have our existence, we continue that.
Sí que lo importante no es solo mirar hacia el frente, sino saber que tenemos nuestra existencia.
We do our best for everybody.
Continuar, hacer todo lo que podamos.
That is something very useful for Tibetan Book of Dead.
Y esto es algo muy útil en el libro tibetano de los
If
muertos.
in the race, then you should learn a little more deeper this knowledge.
Y si os interesa, deberíais profundizar un poco más en este conocimiento.
It is not only kind of history or only a kind of intellectual study.
Y no es solo una historia o un estudio intelectual.
Something concretely related with our existence.
Es algo concreto relacionado con nuestra existencia.
So you do your best.
Así que haced todo lo que
So I
podáis.
think I want to talk only this. If you have some questions, I can explain better.
Solo quería explicaros esto. Si tenéis alguna pregunta, podéis hacerlo y explicarlo.
Ahora nos vamos a crear un regalo. Now we are giving presents.
Okay, thank you very much.
Good morning. It's a very happy moment.
Buenos días, es un momento muy feliz.
Under Rinpoche, under Khandro's leadership, we very successfully finished this event. Official event we have still tomorrow.
Bajo el liderazgo de Chögyal, de nuestro maestro, hemos dado fin a este evento, pero el evento todavía dura unos días.
Anyway, went very well.
En cualquier caso, ha ido muy bien.
I just want to say thank you for everybody and special translators.
Y quiero agradecer a todo el mundo y especialmente a los traductores.
And all the community supporters, the Ganchils, Barcelona Ganchi and Tenerife Ganchil.
Y a todos los que han ayudado y colaborado, especialmente a los ganchiles de Barcelona y de Tenerife.
And also I'd like to thank all the Shangshun team.
Y también dar las gracias a todo el equipo de Shangshun.
And then of course the registers and then who's making this the possibility to all of the world.
Y a los técnicos y los que hacen posible que esto llegue a todo el mundo.
And then now I'm present on behalf of the doctors.
Y ahora estoy haciendo una presentación por parte de los doctores.
They brought some gifts from Tibet to here for the people.
Que han traído algunos regalos del Tíbet para la gente.
So now I want to bring that and give you.
Así que voy a traerlos.
Scalino abbiamo fatto un altro lavoro.
Quando ci vediamo il 21?
Sì, ci vediamo con gioia.
Sì, ja, en het toekomst naar mij ook. Toekomst naar mij ook. Men daar.
We'll bring you cake home. We'll save your cake. What do we do with your cake? Stay there. Okay. Arrive yesterday. Okay. Okay. Thank you so much. Thank you. Bye, Carl.
랑아주 칭칭군이 내일 부드셔.
magari Chögyal 산데레다. Chögyal zembo. Tata Chögyal made.
Comba on tombonding. Okay. This is the number 1. Number 1 we're going to go choice. No one can choice number 1. That is the remaining. Others can choice. Go in a lot.
Chi l'ho portato? Ce l'ho in macchina, la corrente. Sì, questi giorni li faccio, ma non lo so perché qui Tenerife.
Io non ho niente schiappe. Io non ho niente schiappe.
Come stai gestendo? Tu stai di aiuto, ma quella è carne.
Io la c'è giù.
Ah, ci manda va per tu. Tanto Thomas al Cairo. Oh, sì. Lo stava al perone. Oh, ya, lo stava la camonte. Oh, c'ha il monte.
Anche la piscina già fatta, gomma non è. Però un po' c'è.
Sì, qualcuno può fare foto di
lo gioco non va che non di
questa è la zona, questa zona qua
c'è che mangia. Che Satano le ngate combattono giù. Fa vedere questa sulla carta
It's very clear, we are here, no?
Oh.
We already with the swimming pool, this is future, no? The swimming pool.
Full of water. Nice.
to take the seawater. Because there's special treatment that you do specifically with seawater.
뭐지 딴데 간데스 자게 봐.
나.
딴데 간데스 고증한 게.
이번에. 이번에 다다 공민들 저 가르니니 콤바데 돼야.
라소 가르니.
나도 가르쳐야 돼. 줘야 돼. 콤바 나타만 되는 거래.
아, 네.
근데 콤바티 상용체.
라소
콤바티데 아시아. 자, 근데 나도 메인 카운트도 the agenda think kanga karigo gende kanga tai
라소.
가게 나도 조선 타다 요
예, 번쩍 모당 아주 상종 보러와.
상종 컨치부가 마찬에 상종 컨치부가 마찬에 간저 커뮤니티기는 맨도 된도게 부딪히야 지송이
Lo che stanno o PDF o dopo in Word.
Shuma tabane pe non are kadino
라소.
Todo lo che hai PDF o Word. Lo che hai un folder di Sefadia.
del negozio boyale Chögyal non vale
No,
lo
rimasto 4-5. Sì.
con giochi
Qualcosa di coach, di alcuni di coach, di lavoro.
e poi c'era io tenga to shoot up
딴데 스페니시 좋아? 정말로 스페니시 계절 좋아?
Spanish
아주 요가 기계다.
그걸 왜?
생아주 요가 기계다.
이 배짱농나 요주들 왜?
de shiro kera chambrova
배짱농나
Famo Fabio io sto dicendo tu sei molto famoso e che c'è nel libro degli Yantra Yoga
그게 주작가입니다.
she is the teacher of the Vajra dance
이제 보면 되는데 노티칼 파모.
Very famous.
Also 파모.
Avanti Chögyal
Che stai dicendo? Ai ai ai.
언제까지 깨쳐진 게 같지?
스페니시 개만 딱 갖고도 와.
Indicano perché non lo presi? Indica oltre. Ho comprato un cappello, ho trovato 65 centesimi di euro.
Era lasciato a casa.
Invece già lo vale, facendo sciucciano dei punti che trovano, che sciucciamo, per caso.
Phuntsog, qui ci sarà tanto da fare per la medicina.
Koran Institute di Shanghai, nel Koran mi fu da America, John America, America, dove China.
Come America?
Poi America, quando ti kim Italia, duro Italia. Italian America.
Da congiunto in domani è degno di una origine. Kata kaga me yo. Ya ta anen zalin ga domin duwa. Corona Costa Rica.
Costa Rica 하고라.
Costa Rica
따라 아메리카가 이자크더라. 코스타리카도 이자크 마시.
Costa Rica 가라나 가는
코스타리카다가 아르그요 아르그 사리야.
자나다가 항상
속은
소는 청소는
그게 아메리카 가게.
Costa Rica, we don't know Chinese.
Central America.
Italy.
No Chinese.
Chinese Costa Rica. No China.
This one
I'm sure they
Mexico,
Rich
Mexico.
coast. Literally.
어떠래.
coast 가래.
Costa
Costa Rica.
Sì.
다때
Ma io ce l'ho
piccolo, troppo piccolo. Chi ce l'hai? Fagli vedere dove
C'è il mappa del mondo?
한가도 배 에리. 그래 갈지네요.
Io non so, sei un super training translator. Vengo también después. Sí, qué calor. Mira cómo vamos vestidos. I like this one. The last one, the first line. The first line.
This
Not
one
the
is fine.
second one, the first line. Why are you asking?
크게 남기시고 지금 반듯한 말에 Yeah, everybody?
Yeah, everybody.
Yeah, come everybody take photo together.
Esto es para tu tiene la altura para un piso. Por abajo son instalaciones 220. Sí. Y este es el primer piso. Y arriba creo que es terraza. No, terraza no, esto está cubierto. ¿Sí? Está cubierto, antes de estar aquí. Bueno, no, lo que nos dirá. Bueno, yo son los planos aquellos. Sí, pero no, la ventana está definida.
Sì, aquí, però
Benissimo, grazie.
Yo he venido así pequeño para traer la
Yo estoy aquí formando de piedra amarrada sin el material de arte. Yo iba a pegar bastante años.
Que tiene su gracia el sitio, porque aquí adentro se puede crear una cosa aunque fuera de alguna
Gawala, Chipala, Kela.